So I hope you have had an interesting lunch break, and I hope you're settling into day 2 of bio and that the cards are falling into place for you all, and that you know which rooms you're allowed to go into and which ones you're really not. Jeff, it's a pleasure to meet you and to do this. Could you just give a little about your bio?
Yeah, my name is Jeff Mason. I am the Vice President of Sales for Samsung Biologics. I've been in this industry in the CMO space for about a little over 30 years. Started my career back in the mid-90s as an operator, right, entry level. Worked in manufacturing for about 22 of those years, and I've been in the commercial space for the past 10. So very nice to have a chance to speak with you all briefly today.
It is brief, so I'll actually be quick. So from your perspective, the current state of the CDMO industry, the most pressing challenges and the easiest way to navigate through them?
Yeah, no easy way right now. There's a lot of challenges out there right now, but I think I would describe the industry as it's steady growth, as it has been. It's consistent. I think there's a lot of new pressures over the last couple years that we've seen out there. In particular on onshoring, there's a lot of push, and there's a lot of building right now in big pharma. So that's what I'm seeing.
Right, so I won't mention GLP-1s specifically,
Yeah.
but there's been some supply shortages and there's been a bit of geopolitical instability. Now that has a major effect on especially a large player as well.
Yeah, no, absolutely. And I think although there is a lot of talk about onshoring and there's a lot of pressure, I think with what we're seeing at Samsung as they continue to come to us, they are still looking to outsource at least a portion of their pipeline, whether it's their existing pipeline or their emerging pipelines. And so we're here to handle that and be flexible for them as their needs change.
Well, actually, you've been growing disproportionate to the average industry growth, actually. So you've got a new facility in Rockville. Why Rockville and why that facility?
Why Rockville? So we spent a lot of time, really even before some of these pressures emerged, looking for the right fit, the right facility for Samsung. And we feel like we found that with the Rockville's facility that we purchased from GSK recently. Just closed on that at the end of March this year. So we're in the midst of integrating as we speak. That's been going very well. We are looking to continue to make the products that were in that facility originally. They are commercial products, but we're also going to be adding some CMO and additional new products to that facility. It's consistent of both 20K capacity as well as 10K.
Yeah, so one of the themes that I've been hitting this year a lot is the absolute need for increased partnerships, and that no one company, no matter how big or smart, can kind of go alone. Now, alongside that, in parallel, is the rise in complexity, the technical challenges in a lot of the modalities. And so how are you handling those two things together, but especially the rise in complexity part where staff, training, retraining, all these things come into play, even probably the patent applications.
Yeah, so that's exactly what we're seeing is the molecules are becoming more and more complex as the years go by, and we're investing pretty heavily in that capacity, bringing our technology up to speed, of course adding capacity as well. So our three main pillars of growth really are to add capacity. I think you all know that Samsung is pretty good size in terms of capacity, and you can see our aspirations up there on the screen get even larger over the next few years. We're also looking to expand our footprint, and that was basically the first step was with Rockville this year, but I think we're going to see some additional in the years coming up. Both at that site, we're going to continue to expand it, modify it, bring it up to speed, and continue to run that facility as we are today. And then finally, portfolio diversification. I think that's when we get into the technological pieces of this, and that's where we're investing heavily over in Songdo. We're trying to be a full service organization, right from cell line construction all the way through large capacity. So that's our aim and that's our goal.
And so how do you manage the growth with sort of sporadic redundancies amongst the other players? I mean, it's a shifting kind of landscape.
It is. So what we follow is sort of our coin term called excellence. So over in Songdo, all of our plants are built on a certain platform, regardless of scale. This allows for very efficient tech transfers into those plants. It allows us the ability to quickly transfer between plants in different scales as well. But this goes far beyond just the mortar aspects of building a plant. It goes into our quality systems. It goes into our analytical systems and our training and documentation as well. So we have a nice consistent process across all of our plants that we produce product at.
And I'm glad you keep talking about facilities. So are you guys, and is the industry in general moving away from concentrated footprints? And how are you looking at sort of small footprint kind of production, even mobile production units?
Yeah, I mean, again, I think Rockville's the first step there to sort of diversify geographically. But what we do see is a trend when it comes to tech transfer for them wanting more than one node right off the bat, right at launch. And we set ourselves up nicely using this excellence platform where we're able to do a tech transfer from, in about 90 days in Songdo, from an existing donor facility into a receiving facility. So that's out of freeze for the first donating run to out of freeze of the receiving area. So it's about 90 days.
And have as this rising complexity continues to rise, and it's not going away anytime soon, things are becoming more complicated, and now you're getting closer to the hospital world and the world of the patient. Is there conversation about how to better align those things for the future, where you can anticipate a need and start seeing them as being more worthwhile spending time because you can see eventually that will pay off?
Oh, absolutely. I mean, this industry and being successful in this space requires you to listen to the customer every step of the way, see what their challenges are, and you have to adapt to those challenges. And that's exactly what we're trying to do. We're trying to bring the technology in-house. We're trying to stay ahead of the technology curve, and it's moving quickly. But that's really our goal.
Okay. One last question. So I've been using, actually I'll challenge you. I've been using the term Amazonify. And so that happened kind of during COVID, where everything became, oh, we needed it 3 weeks ago kind of thing. So that trend has continued. You don't hear editors write, we're Josh, we don't hear editors write about that as much, but there's that constant nagging pressure in the background to get things done more cheaply, but much more quickly, time to market. So we used to say just in time, and we used to kind of like that term, but now it's kind of Amazonified. So one, can you come up with a better term? I call it frictionless product development. That's also terrible. But also, how do you cope with that? In the real world, that's actually a real menace.
Yeah, I mean, again, I'll come back to excellence. I mean, that really sets us up to move quickly and efficiently through the various product transfers that we have in all the various technologies. It allows us a lot of flexibility between scales as their needs change, as the customer's needs change and their forecasts change. And that's exactly what they've been looking for, is having that flexibility.
No, that's a great response. Thank you. Okay. Questions? We have a little bit of time. So this audience doesn't ask a lot of questions. I'm sure you have questions in mind. Are we going to let Jeff off this way?
I appreciate that.
Okay. For the sake of time, I'll
right.
thank you. Thank you,
Thank you,
Jeff.
Chris.
Right. Appreciate it.
Thank you.